One of the things that you said that was so important is this idea that that people, it's not that they are hateful or afraid of something, they don't know, and the path to learning is exposure, healthy, proper exposure. And what really bothered me, especially when we talk about, you know, people trying to understand the trans experience, is I saw so many people, whether it was face to face or online, saying to people, look, or even whether it was, you know, Black Lives Matter or anything else like that, any, you know, movement, they were saying, all right, I don't get it. So tell me, what am I missing? Help me understand this. And the hostility, the smugness, the condescension where they said, I don't owe you anything. Okay. Number one, you know, go read a book. No, instead of reading a book, how about giving me your your lived experience? Because reading a book is good. That'll give me some theory. That'll give me some, you know, ideas, whatever. Mm. But I've got a chance face to face with somebody to find out a real life experience. And they just attack them, number one. Number two, this is driving me crazy. And I've got this whole series on the power and psychology of language, which people can see on the bottom in the description. It's the manipulation of words. And you were saying that earlier. And this idea that if you ask somebody, for example, when someone accuses me of being a mansplainer or a transphobe or anything, I say, please show me where I said what you're claiming. And the word that drives me crazy is they always say the same thing. Stop demanding. Okay, this manipulation of the word demand. It's taking language which is trying to bridge gaps, is trying to communicate, and people are manipulating it in order to make it look more aggressive than it really is. And this is part of this series I did, which is basically the psychology behind this is, you know, many people are being told, you are a victim, you are powerless, you are weak, everyone's out to get you. You know, there's the oppressors and the oppressed, and sadly, you're the oppressed, which is a good thing because then you get status. Because if you're an oppressor, you're a monster that has to be crushed. And this type of this. Again, it's a distortion of reality. And, you know, I think you were saying that, you know, a lot of these, let's say, quackademics, they have a theory, a pet theory, they have a book, they have a lot invested in it. I do believe that's part of it. But I also believe, and I've seen this with my own colleagues, and I have to be careful on this because this is just a new development. But recently, during this whole Twitter exchange where I had this really aggressive person who really did not want to engage, I should have recognized she's a troll right away. I have this technique of, you know, I try to engage, I give them lots of chance, and then I usually say, you know, sorry, bye-bye, disengage, I'll block. I don't like to block, but if they're just, you know, flooding my wall with nonsense and hate, okay, so I gave her several chances because she looked like she was heading toward discussion and being reasonable. Yep. Whoops, okay, but one of the things was, I asked her, and I just decided to turn it around a little bit because, you know, she's calling me transphobe, etc., and I said, you know what, I actually have patience who I try to strengthen them. I don't want them to feed into this sense of disempowerment and being a victim, but they do feel that using terms like, you know, homophobia or transphobia is co-opting or detracting from their own experience because they do have a legitimate phobia. And A, you're diminishing their own mental health issue, and B, you're associating their issue with such a hateful term, and they don't like it. So I asked this person, this hateful person on Twitter, she said, well, the American Psychological Association accepts it. I actually thought, okay, you know what, if the APA does, I went to my professional organization, the OPA, the Ontario Psychological Association, and I posed a question to my listserv. And I said, what do people think about this inappropriate, inaccurate usage of terms, especially in this day and age where we're trying to be sensitive, we're trying to, you know, not offend. And I got attacked, okay? Now, by several people who, if anyone looks at the other videos that you'll see with my history of the OPA, I have a history with them. So it's got to the point where when I raise any issues, they think I'm trying to disturb shit for the sake of disturbing shit.
Yeah, that's too bad.
Okay, it's terrible. I got unceremoniously kicked off of the listserv. I didn't even know that.
No platforming is a real issue.
Exactly. And you know what? But the thing is this. Among teenagers, among, you know, people at a bar, among Twitter, or, you know, people, I understand that kind of irrationality, that kind of being triggered, that kind of not being able to engage in difficult subjects, I get that. But among psychologists, those of us who are supposed to be trained to be able to deal with difficult issues, to step back, not allow our emotions to override our logic, and to analyze, it doesn't happen. I got shut down. Fortunately, a number of my colleagues apparently stood up and said, this is wrong, because this all happened back in the Jordan Peterson days, back in October. And I was the one, there were a few psychologists, myself and a few others, who said, let him speak. Anyway, the whole point was, it was said to see that professionals in the field were acting like this.
Yeah, but that whole phenomenon surrounding that, I don't think it's even about him because nobody knows him. And I get asked about Jordan Peterson a lot, and I try not to engage because I don't think any good can come from it. I think that's a tire fire at this point that needs to calm down. I don't think anybody is in the position to have a dialogue. The opportunity for a proper dialogue was that debate.
Right.
That was held.
The debacle, you mean? It was at U of T with Brenda Kosman and someone else. Ugh.
And it was badly handled.
Oh,
it was
horrible.
an absolute missed opportunity because they were talking about legal principles with no legal expert present.
Well, Kosman was supposedly, and she was a lawyer, and she gave information that wasn't really accurate.
Yeah,
Brenda Kosman.
she was, but she was a legal ethicist or a legal philosopher or something.
Not a
policymaker.
policymaker.
Who they could get on a very short time frame. It was a panel show. It was not a debate with proper structure. And that wasn't an exchange of ideas like you have at the Monk debate or you have at the Lassonde debate or something like that. That was a bunch of people standing up there and delivering talking points.
Exactly.
There was no respectful challenging of each other. There was no what about this. There was no, and I love discussions. I don't even like using the word debate anymore because debate implies you're trying to win on a binary condition. There has to be a winner and there has to be a loser. Traditionally, debates are just about the exchange of ideas. It doesn't matter as much. It isn't competitive in that regard. Everyone should win through the exchange of ideas.
Right.
And I just think that you mentioned fear and phobia and this whole thing. Now, you as a psychologist know that people tend to assume in other people the state they're feeling themselves.
Right.
They mirror and they tend to transfer. And I think there's a ton of that going on. The people who are advocating these positions are not people who have sort of found their center. They're coming at it from a very reactive place.
Right.
There's a lot of trauma involved. There's a lot of emotion involved. And that's very valid, but the way it is being expressed is an indication of a real lack of proper support systems, that people can't, people feel so perpetually under threat that I call it the Handmaid's Tale phenomenon, that the slightest little legitimate grievance happens to you and you think you're part of this this oppressive systemic plot like you see on TV, right? I am going crazy right now because of the Handmaid's Tale and people comparing, the legitimate issue of many medical doctors taking the complaints of women less seriously than the complaints of men. Legitimate, documented concern.
Right.
But that is not being legally, ritually raped. And they're comparing the two, right? Oops, trigger warning. These discussions go off the rails because it is perceived as an aggressive act because it makes someone feel bad to say to them, hold on, you have a legitimate grievance there, but let's keep things in perspective.
Right.
That is seen as minimizing, that is seen as gaslighting, when in fact, perspective is essentially important to mental health.
I say that in my lecture. Every few months, certain themes, it's not like they're new, it's just that I just... My focus is just picks up on this. I see it over and over and over. And most recently, the whole idea about perspective. That's one of my exam questions where I say it really does all boil down to perspective. So much of it. There's perspective. One of the other things is control, this need. Whether it's too much control, not enough control, internal control, controlling your environment, feeling control. All of these phenomena.
Control. Where do you think the control lies? Yeah.
Right. So again, having a proper discussion and dialogue and pointing this out to people and say, you know what, the way you're doing it, whether you're the person who's feeling like the victim or you're the hero, supposed hero, who is in fact ironically disempowering everybody by the approach that you're taking. Sometimes it's disingenuous, other times it's pure evil, sometimes it's manipulative.
I think the word you're looking for is pathological.
I will take pathological.
There's a pathology to
Yeah.
this. It,
Yeah.
it is infectious. Fear is infectious.
Yeah, and
Panic
yeah.
is infectious.
And I said in one of my podcasts that I consider fear to be perhaps the most powerful motivator. It's usually a demotivator, but whether it drives us into a certain direction, off the cliff, to to hide in our shells, to allow someone else to do something for us, it's just so powerful. And so I have been lecturing for years. It's kind of funny because Jordan Peterson, to bring up his name, like I had him in the midst of all this. I had him come to my class and give a lecture. In fact, one of my
And how did that go?
actually, it went amazing. Believe it or
good.
not. Well, there's a few caveats. First of all, one of my students, I always credit her, Serena, because I was talking about him and his experiences in my classes. It was directly relevant to what was going on in my human sexuality and my psychological disorders classes. And so I would reference him and what was going on. And one of my students said, I can get him in your class. I go, no, you can't. Well, she did. She knew him and she got him in.
Nice.
So yeah, so I had him come to my class. I invited my former and present students to come in. The only problem with it, I've said this 100 times now, but if I had thought about it better, if I'd planned it out better, I would have had I didn't know how my friend was framing it. I would have been out of the frame because I introduced him. I would point to students to ask their questions. I didn't want it to be a discussion of him and me in front of everybody. I wanted them to have a direct opportunity to ask him, you got any issues? You think he's misrepresented something? You don't understand what he's saying? You've got an issue with what he said? Bring it on. Talk to him.
And did people challenge him?
A few people did. I think a lot of it, either challenging or just a very collegial discussion happened after the talk. I had to run to see a patient, but he stood there, he stayed there, spoke to a long lineup of people. And during the talk as well, they challenged him. And that just, he was able to use that as a platform to espouse on quite a few important topics and went on YouTube. People stole it, of course. Okay, I've got 10,000 hits on my thing. He's got, a couple 100,000. Other people had more than his, hundreds of thousands. All I care about is the fact that his themes, his concerns, everything got broadcast to a wide audience. So many people saw it. A lot of people really liked it. He's far blunter than I am.
I think my issue, just to play devil's advocate here, is that he is propagating fear as well. He is overrepresenting the threat he faces. And that is my fundamental disagreement with him. If he could stop saying he was going to go to jail, I would be right on board.
Well, technically, he could go, technically.
It is very, very unlikely. A fine is more likely.
No, but what he said was, and in fact, I saw the Senate hearing because he had a lawyer. I want to say Jared Brown. I know it's Brown, Mr. Brown.
Yeah.
And he said basically because Dr. Peterson would refuse to pay the fine, and refusing to pay the fine would lead to jail.
That is his choice. That is not an oppressive state throwing him in prison for thought crimes.
Okay, I'll give you that. Fine.
And this is my issue. He is scaring people too, and I'd like him to stop. This is why I have not requested an interview with him. I want him to stop scaring people. I want him to stop overstating the threat. He has a very valid concern in that his right to question is being suppressed, especially in psychology that has a unique challenge with the whole phenomenon of transgenderism, for lack of a better term, because the rest of us with social policy and all this stuff, we don't have to worry about clinical practice. In clinical practice, you guys have to deal with the fact that the prescribed treatment for a transgendered person is the polar opposite of everything else in psychology. And this is why it's a hot button. You are adapting the person to treat the state. I don't want to say disorder.
Underlying condition, let's say.
Underlying condition. You are having someone physically adapt themselves because of an underlying condition, as opposed to treating the underlying condition into self-acceptance.
Right.
And this is strange.
Actually, I'll tell you. Yeah, just so you know, just the other day, I've got a backlog on videos. I had a woman whose daughter, same issue, she was 13. She had autism. And she had a therapist who immediately, instead of trying to explore why is she feeling this way, why does she suddenly, out of the blue, never shown any indications, why is he saying, from this point forward, we have to help her transition to the point where at 15 years old, he's trying to pump her up. She's already binding. He wants to pump her up with the hormones and the hormone blockers. And, and then of course next would be surgery. So she said nobody would have her on. No one would speak to her. Of course I had her on because I wanted people to realize there are real people, who are suffering because of this. And we don't know.
And clinicians have to be really careful not to push people into things in that regard. It's a form of malpractice. I mean, the whole teenage transitioning is a controversial subject within, I hate saying communities regarding these things because they're really not. They're collections of individuals that happen to have one thing in common, right? But I know a lot of trans people who oppose transitioning until they're legally an adult. Right. Because the process, the actual medical process, and I do believe that transgender people have a medical condition, not a psychological condition. That's just my belief. But based on the history of these disorders, I think this is where we're going. I mean, we all know that things like homosexuality, feminine hysteria, these were all considered disorders. And then we realized, no, wait, it's not the norm, but it's not unhealthy. Right. Right. And so the problem is that if you transition when you're 9, that is adults deciding for a child that they can never physically reproduce. They can't have children. It affects that. And for some transgendered people, they freeze their sperm or they freeze their eggs or they do something so that they still have the option of having biological children. If a child transitions at 9 or 10, you take away that option from them. Now, the other side, and this is why it's so complicated, is if you start the hormone therapy, the treatment, pre-puberty, especially with trans women, they don't develop the Adam's apple. They don't, a trans man won't develop breasts. So the process is less physically grueling for them to transition. But you're having these major life-affecting choices when someone is very young. And I mean, the research is quite compelling that the majority of trans people do have a deeply held belief at that age that they are whatever you want to call it, gender dysmorphic, born in the wrong body, whatever. But then we have to wonder if this is a symbol of how confining our ideas of gender are, and what does this mean? And so it's a very controversial issue. It's not at all simple. I mean, that was just 3 sides to it. There are far more. Right, and it's certainly not unequivocal. And there's, we've come to no sound conclusions. And by the way, the stats do show that, the majority of children who, at a young age say, I'm not, what my physical sex determines, if nothing happens, if you leave them to their own devices, when they get older, they develop in the way that you would expect based on their physical sex. Okay. This is where 2 statistics say essentially the same thing, but they leave out a detail, right? I mean, it's true. What you're saying is absolutely true. Kids go through experimentations regarding gender. Kids become babies have no gendered preferences that we can find. This is in my lecture on accidental sexism in game design. Gender becomes increasingly important as you move from infancy to early childhood development. Between the ages of 4 and 8, gender is the thing. Boy things, girl things, everything like that. Because kids are starting to go, okay, I am individual, therefore I am different. They're not at the point of individual, but they're groupy, right? As you age through the teenage years into adulthood, gender and gendered preferences start mattering less and less. Now, these are groups, right? For a particular individual, that sense of being displaced might never go away. Right. So, yes, for the majority of transgendered people, that surety that they were, born in the wrong body never goes away. And they knew early, and in a perfect world, we'll be able to scan brains, go, yes, test, good, off you go. But that's not the world we live in. And you're right that, I'm somebody who felt very displaced in that regard, who felt that I was bad at being a girl, who felt that my life would be significantly better if I were male as a teenager. I felt that profoundly as a teenager. There were days I wished, fervently that I was a boy, because my socialization, this whole sex-typical brain, I do not have a sex-typical brain. No, I am atypical.
Are you left-handed?
No,
Okay.
well, for certain things.
Okay, yeah.
For certain things I
There you
am.
go.
There's no heart, but I'm a ginger. So yeah, anomaly. But in terms of all those choices, in terms of all those things that women are supposed to like,
Right.
I don't check those boxes. And my right choice was for me to question the assumptions we make about gender, instead of me conforming to what my individual preferences, society says, should say. I fundamentally reject that.
Right. But one thing, sorry, I just want to jump in because I want to be clear. And that's the thing about the stats that you're saying. When I say about kids who have any, questions or confusion or issues, we don't know at that young age whether, what they are. It's just a normal, healthy process of development where kids, they do recognize, oh, there's something different. And that's where they're trying to figure it out versus someone who actually is transgender. And that's the difference. And that's what I'm saying. So I think too many people, again, are jumping on this. And that's, by the way, earlier when I talked about this woman who attacked me, several people attacked me. I was defending a woman. You may have seen this, the article who wrote that my daughter is not my daughter's a tomboy.
Yes.
Right. And look, I read the piece and I put up on my video. I thought she was being very trans positive. She said if my daughter feels that she's in the wrong body, I'll help her in whatever way possible. She was so pro-female, so pro her daughter, pro everything. And people shat all over her. And I just said, hey, guys, you don't know this woman. Why are you attacking her? And all she said was, my daughter, she's gender role non-conforming.
Gender non-conforming, yeah.
But not gender non-conforming. Okay, it's not that she's confused about her physical sex or who she is. It's just that she doesn't want to fit into these roles, and people took offense to that. And I believe that there is a distinction, that someone who, like as you in your case, that yes, you would have preferred to be a man in certain cases because of this and that, but that was more so because you were seeing that in society, I would have certain advantages, or it would be more in line with how I like to be and stuff like that.
People would not be trying to train me into being a different person.
Right. Yeah.
If I were a different gender.
Right. And that's very different from someone who says, I feel like I'm a fraud. I can't be who I am.
Right. That sense of inauthenticity every time they look in the mirror. Right. That is a fundamentally different thing.
Exactly.
And we have a massive challenge because this is a minority rights issue. And despite ourselves, we are not good at the concept of minority rights, especially when they're relatively small minorities, because all lobby groups, all activist groups, all outreach groups have to play the numbers game. The way money is dispersed, you have to have a certain critical mass. This is why you have people with handicap parking passes that don't really need them in real terms. They have to issue so many or the funding for the program gets cut. Unless you're in a particular threshold, you don't get attention. And this is a fundamental misreading of what Western society was supposed to be about. We're supposed to have checks and balances. We're supposed to have minority rights, right? But we don't have that. It's this tyranny of the majority principle that many of the founding fathers of the United States warned against in representative democracy. And I think the problem is we're trying to run before we walk in a lot of these things. The way these issues are presented, someone like, go back to him, I apologize to Professor Peterson, he's a flashpoint. And this is the problem. I've seen some of his podcasts, I've seen some of his lectures. There is a far more nuanced person there than the person who is depicted in the media.
Sure.
People are not the media constructs that most people know when you are a notable person. The reason I go by Liana K, it's a Kafka reference. It's a reference to Joseph K, because the minute you enter the media, you are guilty of something and you spend the entire time trying to figure out what it is. And that is the reality. You cannot, and this is part of the reason I've stayed out of it, because people are like, what do you think? What do you think? What do you think? Well, as I've stated, I have some issues with his approach. But I don't want people to think that I am attacking him or his right to speak. Right. And you have to pick what idea you decide to come out with first. And that is the only thing you get to say, because when you say that, then everybody starts going, and you don't get to make your second point. You don't get to go, there's this, but there's this. The minute you go, there's this, you are defined by that statement. And now I am defined by my hair going all crazy because I did the hissy fit dance. But this is a huge issue, because if somebody just isolates that clip of me saying he's scaring people, they're going to think I'm anti-Jordan Peterson.
Right.
I'm not. I think he has an absolute right to speak. I don't think this is something that has been well handled. I do not think that this is a discussion that should be had by proxy in opinion pieces in newspapers. I think that you need a bunch of people sitting around without a fucking audience cheering, because that affects the dynamic.
Right.
I think you need a quiet room with a bunch of people who are experts on, for instance, Canadian human rights law, not legal philosophy. Canadian human rights law.
Right.
You need some legislators in that room saying no, because the new thing is, oh, you can unintentionally misgender someone and then you go to jail. This is what people, especially outside of Canada, believe because of this tempest in a teapot. They have been frightened into believing that we live in an Orwellian thought police state, and we don't. And you know, it is a lot of processes, and you have to make a lot of choices to be imprisoned for speech.
Right.
There's a very high bar. If there wasn't, I would be in jail. You know, Ezra Levant would be in jail. Tariq Fatah would be in jail. And there's a dude who actually has a fatwa out against him.
Right.
I mean, let's not disrespect guys like that for overstating the risk to other people with controversial opinions. Right. And for me, I think I have a bit of an emotional response to this whole thing, because I do my damned best, because part of my stock and trade is being funny. And people can't laugh with me if they feel like they're laughing at me. And the minute people see me as a victim of some sort of persecution, laugh with becomes laugh at. And I don't want people to be afraid to come along this absurdist journey, you know, with me. It's foolish, the age we're living in has a great deal of foolishness, and we can confront the foolishness without fear if we see it as foolishness and not fascism, you know. And I think we got to take the pressure off. But the only way the media pays attention is if you frame something with a potential dire consequence, because then you've got this heroic epic instead of this wonderful, you know, farcical common story, which there's no room for anymore. It drives me crazy. Everybody has to be off-red. Nobody can be Carrie from Sex and the City anymore, right? And that really concerns me, because that sense of perspective, again, people need to be able to laugh. People need to be able to get off that train. And as much as we do have some very serious challenges facing us, we are facing a real slide into illogic, a real slide into alternative facts.
Right.
We really have to recognize that in general, broad terms, I'm talking decade by decade progress, society is moving in the right direction. We